Welcome, future nurses. You have officially made it to day 18 of our epic 30-day NCLEX challenge. And if you have stuck with us so far, give yourself a big round of applause. You are now more than halfway through solving all 30 full-length NCLEX practice tests, and together, we are tackling 2,000 of the most commonly repeated NCLEX questions. Yes, I am talking about those high-yield, exam-repeating, priority-based scenarios that love to appear again and again on the real NCLEX. Now, before we dive into today's clinical brain workout, I have something incredible to share. And trust me, you are going to want this. For a limited time, we are giving you 5 days of free access to our complete NCLEX crash course. Yes, totally free. No strings attached, no payment required. All you need to do is click the WhatsApp link in the description box and simply say, "Hi." That's it. Our team will instantly enroll you and send you full access to live and recorded NCLEX classes, Next-Gen NCLEX, NGN case study questions, over 5,000 previously asked NCLEX questions, custom study planners for 1 week and 1 month, and PDF notes with full support from our NCLEX educators. And the best part? You do not lose anything, but you gain 5 days of premium prep time that could completely change your NCLEX journey. So, what are you waiting for? All right, grab your notebook, turn off distractions, and let's jump into practice test 18. Your next set of high-yield, test-ready NCLEX questions. Let us begin practice test 18 with a high-yield question 1 on heart failure management. A nurse is evaluating the effectiveness of bumetanide therapy in a client with volume overload due to heart failure. Which clinical finding best reflects a desired therapeutic effect of this medication? The options are A. Elevated central venous pressure, B. Decreased ventricular preload and reduced wall stress, C. Suppressed glomerular filtration rate, D. Increased systemic vascular resistance. The correct answer is option B, decreased ventricular preload and reduced wall stress. Bumetanide is a powerful loop diuretic that removes excess fluid, reducing preload and ventricular stretch. This improves cardiac output and relieves symptoms like pulmonary congestion. In contrast, option A is incorrect because elevated central venous pressure signals worsening fluid overload. Option C is undesirable since a suppressed glomerular filtration rate suggests reduced kidney perfusion, not a goal of therapy. Option D is also incorrect, as increased systemic vascular resistance strains the heart, whereas bumetanide A aims to reduce cardiac workload. Moving on to question 2, let us shift our focus to emergency cardiac care. A nurse observes a chaotic, disorganized rhythm on the cardiac monitor that resembles ventricular fibrillation. What should be the nurse's immediate priority action? The options are A. Announce a code blue and prepare for immediate resuscitation, B. Insert a peripheral intravenous cannula for emergency access, C. Alert the primary healthcare provider about the abnormal tracing, D. Verify the rhythm by assessing the client's airway, breathing, and circulation. The correct answer is option D. Verify the rhythm by assessing the client's airway, breathing, and circulation. Even though the monitor appears to show ventricular fibrillation, the nurse must first assess the client directly to confirm the rhythm is real. Artifacts from movement, tremors, or electrode issues can mimic life-threatening rhythms. Confirming unresponsiveness, no pulse, or apnea ensures appropriate action, like cardiopulmonary resuscitation, is taken. Option A is incorrect because calling a code without verifying the client's status may lead to unnecessary resuscitation. Option B is not the first step. Vascular access is important but secondary to client assessment. Option C is premature. Nurses must independently assess and intervene in emergencies before calling the provider. Now, let us move on to question 3, which focuses on client safety during electroconvulsive therapy, or ECT. A client is scheduled for ECT in the morning. To help prevent airway and procedural complications, which of the following should the nurse evaluate during the pre-procedure assessment? The options are A. Sensory perception in the legs, B. Condition of the client's teeth and oral cavity, C. Upper extremity muscle strength, D. Presence of peripheral vision deficits. The correct answer is option B. Condition of the client's teeth and oral cavity. During ECT, the client experiences strong jaw contractions despite the use of muscle relaxants. Loose teeth or poor oral integrity can lead to broken teeth, aspiration, or airway obstruction during the seizure. Evaluating the dentition allows the nurse to identify risks early and notify the healthcare provider if needed. Let us continue with question 4. which highlights a classic gastrointestinal emergency. A client arrives at the emergency department complaining of sharp, cramping upper abdominal pain that comes and goes, accompanied by nausea, vomiting, and noticeable yellowing of the eyes. Based on these symptoms, which condition is the nurse most likely to suspect? The options are A. Peptic ulcer disease, B. Hepatitis, C. Cholecystitis, D. Hepatic encephalopathy. The correct answer is option C. Cholecystitis. This condition involves inflammation of the gallbladder, commonly due to gallstones obstructing the cystic duct. The hallmark features include colicky right upper quadrant pain that may radiate to the back or shoulder, nausea, vomiting, and jaundice if the common bile duct becomes blocked. These symptoms, especially the intermittent pain and yellowing of the eyes, are classic for cholecystitis. Option A is incorrect because peptic ulcer disease typically causes steady epigastric pain and does not lead to jaundice. Option B is not the best choice, as hepatitis C may cause jaundice but usually presents with dull, not cramping, pain. Option D is also incorrect. Hepatic encephalopathy presents with mental status changes, not abdominal pain. Up next is question 5, which brings us into the critical area of fetal monitoring during labor. A client in the second stage of labor is undergoing continuous fetal heart tracing, and the nurse observes that the fetal heart rate begins to decelerate after each contraction and returns to baseline slowly. What should the nurse do first in response to this finding? The options are A. Immediately notify the primary healthcare provider, B. Instruct the client to practice slow, deep breathing techniques, C. Reposition the client onto her left lateral side, D. Request a prescription to begin intravenous isotonic fluids. The correct answer is option C. Reposition the client onto her left lateral side. This is the most immediate and appropriate response to late decelerations, which indicate utero-placental insufficiency. Turning the client to her left side relieves pressure on the vena cava and improves blood flow to the uterus, enhancing oxygen delivery to the fetus. It is a fast, nurse-initiated intervention that can improve fetal well-being. Before we move to the next question, here is something powerful that could transform your NCLEX journey. Over 100,000 nurses have already passed the NCLEX with this course. And now, it is your turn. We are offering you a completely free 5-day trial of our NCLEX crash course. That includes live and recorded NCLEX classes, NGN case studies, over 5,000 exam questions, personalized study planners, and downloadable notes, all designed to get you exam-ready faster. Just click the WhatsApp link in the description and type, "Hi." That is all it takes. Our team will instantly enroll you, and your success story begins today. Move to question 6. Let us now look at a critical medication safety question 6. A client with acute coronary syndrome has a new prescription for a weight-based continuous infusion of unfractionated heparin. Before starting this high-alert medication, which action must the nurse take first? The options are A. Draw blood for serum creatinine, B. Obtain and document the client's current body weight, C. Send a specimen for international normalized ratio, or D. Confirm a 20-gauge intravenous access site. The correct answer is option B. Obtain and document the client's current body weight. Here is why. Unfractionated heparin dosing is weight-based, and using an accurate current body weight is essential to avoid under- or overdosing. This step ensures safe and effective anticoagulation, especially in high-risk conditions like acute coronary syndrome. In contrast, option A is more relevant for low molecular weight heparins. Option C monitors warfarin, not heparin. And option D, while helpful, is not the top priority for this specific drug. Let us switch gears and explore a question 7 that highlights psychosocial bonding in the postpartum period. During a home visit, a nurse observes a new father gazing into his newborn's eyes, smiling warmly, and gently caressing the baby's head. How should the nurse document this behavior? The options are A. Binding in, B. Engrossment, C. Entrainment, or D. Detachment. The correct answer is option B. Engrossment. Engrossment refers to a father's deep emotional involvement and affectionate bonding with his infant. This often includes eye contact, tactile interaction, and a clear desire to nurture and be near the newborn. It is a healthy and expected behavior that signifies strong paternal attachment. On the other hand, option A, binding in, is typically seen in mothers as they begin emotionally claiming the infant by identifying physical or personality traits. Option C, entrainment, describes the infant's rhythmic response to a parent's voice or facial expressions, not the parent's actions. Lastly, option D, detachment, is an abnormal reaction marked by emotional distance, which is the opposite of what the nurse observed in this case. Now, let us turn our attention to client safety, specifically fall risk assessment upon admission. Question 8. A client has just arrived on the medical surgical unit, and the nurse needs to accurately evaluate the client's risk of falling. Which action will provide the most reliable information? The options are A. Observe the client while ambulating to assess gait and balance. B. Assess the client's ability to shift positions while lying in bed. C. Ask family members about the client's usual walking patterns at home. Or D. Rely on the client's report of their walking and balance abilities. The correct answer is option A. Observe the client while ambulating to assess gait and balance. Here is the rationale. The most accurate way to assess fall risk is through direct nurse observation of the client's mobility. Watching the client walk, turn, or transfer provides objective, real-time data about their posture, steadiness, and any signs of instability, such as shuffling, hesitation, or imbalance. This is far more dependable than secondhand reports. In contrast, option B only evaluates bed mobility and does not indicate how well the client performs when standing or walking. Option C offers family insight, which may be outdated or inaccurate, especially if they have not recently seen the client ambulate. Option D, self-report, can be misleading, as clients may underestimate their fall risk due to fear, pride, or lack of awareness. Let us continue by focusing on respiratory assessment techniques, particularly tactile or vocal fremitus. Question 9. During a physical exam, the nurse wants to assess tactile fremitus in an adult client. Which technique is the most appropriate? The options are A. Position the thumbs at the level of the 9th ribs and observe for symmetrical chest movement. B. Ask the client to take deep breaths through an open mouth while auscultating the lung fields. C. Palpate the chest wall while the client repeats 99 starting at the lung apex. Or D. Tap the chest using the middle finger placed over the distal joint of the other hand. The correct answer is option C. Palpate the chest wall while the client repeats 99 starting at the lung apex. Here is the rationale. Tactile fremitus refers to the vibrations that are felt on the chest wall when a client speaks. To evaluate this, the nurse places the palmar surface or ulnar edge of the hand on the client's chest, beginning at the apex of the lungs and moving downward while the client repeats a phrase like 99. This allows the nurse to detect changes in vibration, which may indicate underlying pathology like pneumonia, pleural effusion, or pneumothorax. Option A describes assessment of chest expansion, not fremitus. Option B is correct for auscultation, and option D refers to percussion, a different method used to detect underlying air or fluid, but not vibrations from speech. Next, let us turn our attention to pharmacology and a medication commonly used in asthma management, montelukast. Question 10. While reviewing a client's medication record, the nurse notes that the client is prescribed montelukast for chronic asthma. Which finding, if observed, should be recognized as a potentially serious adverse effect of this drug? The options are A. Elevated blood pressure readings. B. Reports of seeing things that are not there. C. Complaints of infrequent bowel movements. Or D. Difficulty initiating urination. The correct answer is option B. Reports of seeing things that are not there. Here is the rationale. Montelukast is a leukotriene receptor antagonist used for long-term control of asthma and allergies. But one serious and less commonly known adverse effect is neuropsychiatric symptoms. These can include vivid dreams, anxiety, aggression, depression, suicidal thoughts, and hallucinations. So, if a client reports seeing things that are not actually present, it indicates hallucinations, a red flag that requires immediate provider notification. Option A, elevated blood pressure, is not typically associated with montelukast, but may occur with corticosteroids. Option C, constipation, and option D, urinary retention, are not side effects of montelukast either, and are more often linked to other drug classes such as opioids or anticholinergics. Now let us move into a high-risk airway safety scenario. Question 11. The nurse is caring for a client with a Sangstaken-Blakemore tube in place for bleeding esophageal varices. During the safety check, which item must be kept immediately at the bedside to manage a potential airway emergency? The options are option A, an emergency tracheostomy kit, Option B, sterile scissors. Option C, an obturator for tracheostomy insertion. And option D, a Yankauer oral suction catheter. The correct answer is option B, sterile scissors. This is because a migrated balloon from the Sengstaken-Blakemore tube can compress the trachea, causing airway obstruction. In such emergencies, the nurse must act quickly by cutting the lumens of the tube to deflate the balloons and relieve pressure. Sterile scissors make this life-saving intervention possible and are a required safety measure. Option A, the tracheostomy kit, is not the first-line response in this case. Option C, the obturator, is irrelevant to this type of tube, and option D, the Yankauer, is used for oral suctioning, not for resolving balloon-related airway obstruction. Always remember, when managing a client with a Sengstaken-Blakemore tube, sterile scissors must be at the bedside at all times. Let us now focus on respiratory management in pediatric care. Question 12. The nurse is preparing to perform chest physiotherapy on a child diagnosed with cystic fibrosis. To ensure the procedure is as effective as possible, which action should the nurse take before beginning the treatment? The options are: Option A, apply continuous pulse oximetry to monitor oxygen levels during chest physiotherapy. Option B, instruct the child to perform incentive spirometry exercises. Option C, provide oxygen via nasal cannula for pre-procedural support. And option D, administer the prescribed bronchodilator medication. The correct answer is option D, administer the prescribed bronchodilator medication. Administering a bronchodilator prior to chest physiotherapy helps open up the airways, reduces bronchospasm, and allows thick mucus to be more easily mobilized during percussion and postural drainage. For clients with cystic fibrosis, who often struggle with thick pulmonary secretions, this step greatly enhances the effectiveness of the therapy. On the other hand, option A, continuous pulse oximetry, may be useful for select clients with unstable oxygenation, but it is not required for everyone undergoing chest physiotherapy. Option B, incentive spirometry, supports lung expansion, but is more beneficial after the procedure rather than before. Meanwhile, option C, providing oxygen via nasal cannula, is not routinely recommended unless the client is already hypoxic. Question 13. Stepping into the world of acute endocrine emergencies, we focus on a client with type 1 diabetes who has been admitted with diabetic ketoacidosis. Question 13. During the course of treatment, which laboratory value requires the most frequent and careful monitoring? The options are: Option A, blood urea nitrogen, Option B, serum creatinine, Option C, serum potassium, and Option D, serum magnesium. The correct answer is Option C, serum potassium. In diabetic ketoacidosis, potassium shifts are a major concern. At the onset, acidosis causes potassium to move out of the cells, leading to an initially elevated serum level. However, once insulin therapy begins, potassium is driven back into the cells, often resulting in hypokalemia, a dangerous drop that can cause cardiac arrhythmias, muscle weakness, and respiratory failure. Because of this, potassium must be monitored closely and replaced as needed, even if initial levels appear normal or elevated. While option A, blood urea nitrogen, may increase due to dehydration, it is not the immediate threat. Option B, serum creatinine, gives insight into renal function but does not require urgent hourly monitoring. Option D, serum magnesium, is important in select scenarios, but it is not the top priority during acute DKA treatment. Shifting our focus to nutrition and renal care, let us examine dietary choices for a client undergoing hemodialysis due to chronic renal failure. Question 14. The nurse is evaluating the client's menu selection to assess understanding of appropriate dietary restrictions. Which of the following choices reflects proper adherence to a renal diet? The options are: Option A, blueberries, cream of wheat, and black coffee. Option B, bacon, banana, and a glass of orange juice. Option C, sausage, scrambled eggs, and tomato juice. And option D, cured pork, grits, and sliced kiwi. The correct answer is option A, blueberries, cream of wheat, and black coffee. This menu is appropriate because it is low in potassium, sodium, phosphorus, and protein, all critical elements to control in clients with chronic kidney disease. Blueberries are kidney-friendly and rich in antioxidants. Cream of wheat is a low-phosphorus grain, and black coffee in moderation is acceptable when fluid intake is monitored. In contrast, Option B includes bacon, banana, and orange juice, all high in sodium and potassium, which can lead to fluid overload and hyperkalemia. Option C contains sausage and tomato juice, both high in sodium and potassium, while option D includes cured pork and kiwi, also high in phosphorus and potassium. Let us now explore an emotionally sensitive but critically important topic in nursing: elder abuse and mandated reporting. Question 15. A 78-year-old female client arrives at the emergency department with an arm injury. During the nurse's assessment, multiple bruises in various stages of healing are noted on her chest and legs. When asked about them, the client hesitantly admits that her adult son hits her when meals are not prepared on time. What is the nurse's most appropriate response in this situation? The options are: Option A, "Oh, really? I think I should have a word with your son about this." Option B, "Thank you for sharing this. As a mandated reporter, I am legally required to report this information for your safety." Option C, "Maybe we can come up with a way to help you get things done on time and avoid upsetting your son." And option D, "Is there a friend or someone close to you who can help protect you while you try to sort this out with your son?" The correct answer is option B. This response reflects both therapeutic communication and legal responsibility. Nurses are mandated reporters, meaning they are required by law to report suspected abuse, including elder abuse, even without the client's consent. By acknowledging the client's courage and clearly explaining the need to report for her safety, the nurse maintains trust while fulfilling a legal obligation. Option A, confronting the son directly, is unsafe and unprofessional. Option C is inappropriate because it implies blame on the client and attempts to justify the abuse. Option D shifts the burden of protection to the client and avoids the nurse's legal responsibility. Wait, before jumping into the next question, are you ready to pass the NCLEX on your first try? Then do not miss this. You are getting 5 full days of free access to our complete NCLEX crash course, used by over 100,000 successful nurses worldwide. Inside, you will find live coaching, NGN case scenarios, 5,000 plus actual exam questions, and expert-curated study guides. Just scroll to the description, click the WhatsApp link, and type, "Hi." Thousands are already leveling up. The only question is, will you catch up or fall behind? Turning our focus to prenatal care, let us look at a 25-year-old client who is 32 weeks pregnant and attending a routine prenatal visit. Question 16. Based on the nurse's assessment and laboratory results, which observation requires the most immediate follow-up? The options are: Option A, presence of glucose in the urine; Option B, mild swelling of the feet reported at the end of the day; Option C, increased vaginal discharge without odor or irritation; and Option D, a hemoglobin level of 14 grams per deciliter. The correct answer is Option A, presence of glucose in the urine. While mild glycosuria can occur during pregnancy due to increased kidney filtration, the detection of glucose in the urine at 32 weeks raises concern for possible gestational diabetes mellitus. Since this condition typically emerges between 24 and 28 weeks and can lead to serious complications like fetal macrosomia, birth trauma, and neonatal hypoglycemia, it is essential that the nurse reports this finding promptly for further testing, such as a glucose tolerance test. Option B, mild late-day foot swelling, is a common occurrence in the 3rd trimester and usually resolves with rest and elevation. Option C, increased vaginal discharge without odor or irritation, is typical during pregnancy and is known as leukorrhea. It is considered normal unless it becomes foul-smelling, bloody, or irritating. Option D, a hemoglobin level of 14 grams per deciliter, is well within the normal range for pregnant clients and indicates adequate red blood cell status. Let us now shift to safe procedural preparation. Question 17. Particularly when caring for a client scheduled for a computed tomography scan with intravenous iodinated contrast. To ensure appropriate and safe preparation, which action should the nurse take? The options are: Option A, ask the client if they have a shellfish allergy; Option B, insert a 20-gauge intravenous catheter to establish vascular access; Option C, check the client's capillary blood glucose before the procedure; and Option D, instruct the client to restrict fluid intake after the scan. The correct answer is Option B, insert a 20-gauge intravenous catheter to establish vascular access. For CT scans requiring intravenous contrast, the nurse must ensure a large bore, well-functioning intravenous is in place, typically 20 gauge or larger, to allow for rapid infusion of the contrast medium. This helps prevent complications like contrast extravasation, which can cause tissue injury if the contrast leaks into the surrounding tissues. Option A is incorrect, because the belief that a shellfish allergy predicts a contrast reaction has been scientifically disproven. Contrast reactions are unrelated to iodine content or shellfish proteins. Option C, checking capillary blood glucose, is not a standard requirement unless the client is on metformin or undergoing a different type of scan, such as a PET scan. Option D is also incorrect, as clients should actually be encouraged to increase their fluid intake after the scan to help eliminate the contrast from their kidneys and reduce the risk of nephrotoxicity. Let us now explore how personal background influences nutrition. Question 18. While assessing a client's dietary habits, the nurse considers various factors that might affect the client's food choices. Which factor is most likely to influence the client's food preferences? The options are: Option A, the client's cultural and ethnic background. Option B, how often the client goes grocery shopping. Option C, the availability of specific foods in the client's community. And Option D, the cost of food items at local grocery stores. The correct answer is Option A, the client's cultural and ethnic background. Culture plays a foundational role in determining which foods are preferred, how meals are prepared, and when or how they are consumed. It also includes religious dietary rules, traditional meals, and family eating customs that shape long-term eating patterns. In contrast, Option B, grocery shopping frequency, may affect access to fresh foods, but does not shape a person's core preferences. Option C, local food availability, can influence what someone eats but does not necessarily change what they desire or consider normal. Option D, cost, affects affordability, not preference itself. For the NCLEX, remember, cultural and ethnic background is the most significant factor influencing food choices, and understanding it helps nurses provide respectful and individualized nutritional education. Let us now focus on post-procedural nursing care during a common respiratory intervention. Question 19. A primary healthcare provider is preparing to remove a client's chest tube following the resolution of a pneumothorax. Which nursing action is most appropriate to perform before the removal procedure? The options are: Option A, administer the prescribed pain medication. Option B, apply oxygen via nasal cannula at 4 liters per minute. Option C, clamp the chest tube for 2 hours prior to removal. And Option D, ask the client to empty their bladder beforehand. The correct answer is Option A, administer the prescribed pain medication. Chest tube removal can be painful as the tube is pulled through the chest wall, and giving analgesics, such as opioids or non-steroidal anti-inflammatory drugs, 30 to 60 minutes prior helps reduce discomfort and anxiety, promoting a smoother and more tolerable experience. Option B, applying oxygen, is not routinely necessary unless the client has existing respiratory distress or low oxygen saturation. Option C is incorrect, because prolonged clamping of a chest tube is no longer recommended, as it may increase the risk of tension pneumothorax. Finally, Option D, asking the client to empty their bladder, is not relevant for this procedure, as it does not involve abdominal or pelvic pressure. Let us now consider safe delegation and supervision in diagnostic procedures. Question 20. A nurse is supervising a newly hired nurse who is preparing a client for a scheduled brain-computed tomography scan with intravenous contrast. Which action by the new nurse would require the supervising nurse to intervene? The options are: Option A, encouraging the client to drink extra fluids after the scan is completed. Option B, verifying that informed consent has been obtained before the procedure. Option C, ensuring the stretcher side rails are raised during transport to the imaging suite. And Option D, canceling the scan due to the client's self-reported allergy to shellfish. The correct answer is Option D, canceling the scan due to the client's self-reported allergy to shellfish. This outdated belief incorrectly assumes that a shellfish allergy increases the risk of reaction to iodinated contrast, but the allergens in shellfish are unrelated to iodine. The American College of Radiology clarifies that shellfish allergy is not a contraindication to contrast use. Instead, nurses should ask about prior reactions to contrast media specifically. Canceling the scan unnecessarily could delay critical diagnostic care. In contrast, Option A reflects best practice, as encouraging fluids helps flush the contrast from the kidneys. Option B is appropriate, as informed consent is required before administering contrast due to the potential for allergic or renal complications. Option C is also correct. Raising stretcher side rails ensures safe transport and demonstrates proper attention to fall prevention. Let us take a closer look. Question 21 at how nurses can support the emotional recovery of clients facing major physical changes. A nurse is caring for a client who is recovering from extensive reconstructive surgery following a severe burn injury. The client is showing signs of emotional distress about their appearance and has begun withdrawing from social interactions. Which nursing intervention is most appropriate to support the client's psychosocial needs? The options are: Option A, discourage the client from looking in mirrors to prevent emotional upset. Option B, encourage the client to talk openly about their feelings related to their appearance. Option C, recommend focusing solely on physical healing and ignoring emotional concerns. And Option D, suggest the client wear clothing that hides surgical scars to avoid unwanted attention. The correct answer is Option B, encourage the client to talk openly about their feelings related to their appearance. This therapeutic approach allows the client to express fear, grief, or insecurity in a safe, non-judgmental environment. It also helps build trust, validate their experience, and reduce isolation, key components in psychosocial healing after disfigurement. In contrast, Option A encourages avoidance, which can delay emotional adjustment. Option C ignores the client's emotional well-being, which is vital to holistic care. Option D promotes concealment, which may reinforce shame instead of fostering acceptance. Now let us focus on infection control and room assignments, a critical decision for client safety. Question 22. A charge nurse is assigning rooms on a medical surgical unit and has only one private room available. Which client should be prioritized for that private space based on infection control needs? The options are: Option A, a client with epilepsy who experienced a tonic-clonic seizure 2 hours ago. Option B, a client with a urinary catheter and a urine culture positive for Proteus mirabilis. Option C, a client with viral meningitis who has a fever. And Option D, a client with Clostridium difficile infection and stool incontinence. The correct answer is Option D, a client with Clostridium difficile infection and stool incontinence. This client must be placed under strict contact precautions, as C. Difficile spores are highly contagious, environmentally resilient, and easily spread, especially when stool incontinence increases the risk of surface contamination. A private room minimizes the chance of transmission and allows for controlled cleaning using bleach-based disinfectants and hand washing with soap and water. Option A does not require isolation, as epilepsy is not infectious. Option B, although involving a urinary pathogen, typically does not warrant a private room unless the client has open wounds or poor hygiene. Option C, viral meningitis, is generally less contagious than bacterial meningitis and can be managed with standard precautions. Let us now explore safe and effective delegation, a core responsibility of the charge nurse. Question 23. While assigning tasks to an unlicensed assistive personnel on a medical surgical unit, which of the following tasks is appropriate to delegate? The options are: Option A, collect a sterile urine specimen from a client's indwelling urinary catheter. Option B, increase the flow rate on a nasal cannula by 1 liter per minute. Option C, measure and document the amount of fluid collected in a suction canister. And Option D, remove a nitroglycerin patch prior to giving a bed bath. The correct answer is Option C, measure and document the amount of fluid collected in a suction canister. This task falls within the UAP's scope of practice, as it involves measuring and recording output, an objective, non-invasive task that does not require clinical judgment. In contrast, Option A involves sterile technique and infection control, which must be handled by a licensed nurse. Option B requires assessment and decision-making regarding oxygen therapy, which is not within the UAP's role. Option D is also inappropriate, as removing a medication patch like nitroglycerin constitutes medication administration and is restricted to licensed personnel. Let us now look at a common skin change that often causes concern for first-time pregnant clients. Question 24. A nurse at an obstetric clinic receives a phone call from a client in her second trimester who is worried about a dark vertical line that has developed down the center of her abdomen. Which of the following should the nurse recognize this as? The options are: Option A, cloasma, Option B, linea nigra. Option C, Goodell sign. And option D, striae gravidarum. The correct answer is option B, linea nigra. This is a normal, harmless skin change that appears in many pregnant individuals during the second trimester, resulting from increased melanin production triggered by hormonal changes, particularly estrogen and melanocyte-stimulating hormone. The line typically runs from the pubic area to the umbilicus, and sometimes even higher, and it usually fades after delivery. Option A, chloasma, is hyperpigmentation of the face that presents as dark patches on the cheeks and forehead, commonly emerging in the first trimester. Option C, the Goodell sign, refers to softening of the cervix, not a skin change, and is detected during a pelvic exam. Option D, striae gravidarum, or stretch marks, appear as reddish or purplish streaks caused by rapid skin stretching, usually on the abdomen, thighs, or breasts. Let us turn our attention to pediatric safety and proper supervision in clinical practice. Question 25. A nurse is overseeing a graduate nurse who is caring for a child diagnosed with cerebral palsy. Which of the following actions by the new nurse would require the supervising nurse to intervene? The options are: Option A, initiating gentle range of motion exercises to prevent contractures. Option B, lowering the bed to its lowest position after repositioning the client. Option C, taking the client to the playroom using a wheelchair. And option D, feeding the child while keeping the head of the bed elevated at 30 degrees. The correct answer is option D, feeding the child while keeping the head of the bed elevated at 30 degrees. Children with cerebral palsy often experience oropharyngeal dysphagia, placing them at high risk for aspiration during feeding. To prevent this, the child must be fed upright or with the head of the bed elevated between 45 and 90 degrees. A 30-degree angle is not adequate and could result in serious complications such as aspiration pneumonia, making this a situation that requires immediate intervention. In contrast, option A is a safe and supportive practice, as gentle range of motion exercises help maintain joint flexibility and prevent contractures. Option B demonstrates proper safety protocol by minimizing fall risk, and option C promotes emotional well-being through play and social engagement. Hey, quick break before the question 26. I want to share something that could really help. Did you know over 100,000 nurses have used our NCLEX crash course to pass confidently? You can try it free for 5 days, no fees, no commitment. It comes with live and recorded lessons, next-gen NCLEX practice, 5,000 plus real questions, planners, and full support from our team. Just click the WhatsApp link below and send a simple "Hi." That is all. We will enroll you right away, and you can begin learning with us today. Let us now explore. Question 26, how to evaluate the effectiveness of antidepressant therapy in clinical practice. A nurse is assessing a client with major depressive disorder who has recently started bupropion. Which finding would best indicate that the medication is achieving its intended therapeutic effect? The options are: Option A, the client reports improved mood and increased energy levels. Option B, the client exhibits fewer episodes of elevated mood and risky behaviors. Option C, the client experiences fewer seizure episodes. And option D, the client reports reduced cravings for alcohol. The correct answer is option A, the client reports improved mood and increased energy levels. Bupropion is an atypical antidepressant that enhances norepinephrine and dopamine activity in the brain, helping to relieve symptoms of depression such as low energy, poor concentration, and anhedonia. A noticeable improvement in mood and motivation is the clearest sign that the medication is working. Option B is incorrect because bupropion is not used to stabilize mood in bipolar disorder and can even trigger manic episodes if used without a mood stabilizer. Option C is incorrect because bupropion actually lowers the seizure threshold and is contraindicated in clients with a history of seizures. Option D is also incorrect. While bupropion is approved for smoking cessation, it is not typically used to treat alcohol cravings. Let us now explore question 27. A foundational neurological assessment tool often used in clinical practice. A primary healthcare provider suspects a neurological condition and asks the nurse to prepare a client for a Romberg test. Which instruction should the nurse give to ensure the test is performed accurately? The options are: Option A, stand with your feet together and arms resting at your sides. Option B, tuck your chin to your chest while lying flat on your back. Option C, rest both elbows on the table and flex both wrists at 90 degrees. And option D, place one heel on the opposite shin and slide it downward to the foot. The correct answer is option A, stand with your feet together and arms resting at your sides. This position is essential for conducting the Romberg test, which evaluates proprioception by observing the client's balance first with eyes open and then closed. A positive Romberg sign is when the client maintains balance with eyes open but begins to sway or fall with eyes closed, indicating a sensory or proprioceptive deficit. Option B describes the Brzezinski sign used in meningitis assessment. Option C outlines Phelan's test for carpal tunnel syndrome, and option D refers to the heel-to-shin test for cerebellar coordination. For NCLEX success, remember, the Romberg test assesses balance and sensory input, and correct positioning is key to an accurate result. Now let us focus on accurate fluid monitoring. Question 28 in clients with hepatic disorders. A nurse is caring for a client with advanced liver cirrhosis and moderate ascites. To monitor fluid accumulation effectively, the healthcare provider has ordered daily abdominal girth measurements. Which anatomical landmark should the nurse use to ensure reliable and consistent monitoring? The options are option A, xiphoid process, option B, umbilicus, option C, iliac crest, and option D, symphysis pubis. The correct answer is option B, umbilicus. The umbilicus serves as a central and reproducible point for abdominal girth measurements, especially in clients with ascites. Measuring at this level each day in the same position, typically supine, ensures accuracy in tracking changes in abdominal fluid volume related to portal hypertension and liver dysfunction. Option A, the xiphoid process, is too high on the torso and not suitable for capturing mid-abdominal distension. Option C, the iliac crest, is too lateral and inconsistent for girth assessment, while option D, the symphysis pubis, is positioned too low to reflect changes in acidic fluid accurately. For NCLEX, always remember, when monitoring abdominal girth, the umbilicus is the gold standard anatomical reference for precision and consistency. Let us now explore therapeutic communication. Question 29 and group facilitation within the context of mental health nursing. During a group therapy session focused on substance use recovery, the nurse observes that one client is consistently dominating the conversation, making it difficult for others to contribute. What is the most therapeutic and effective action for the nurse to take in this situation? The options are option A, ask the client to leave the session to avoid further disruption. Option B, pause the discussion and review group guidelines with all members. Option C, allow the client to continue sharing without interruption. And option D, invite the group to express their thoughts and feelings about how the session is going. The correct answer is option D, invite the group to express their thoughts and feelings about how the session is going. This approach promotes self-awareness and respectful confrontation within the group, allowing members to address interpersonal dynamics in a constructive and supportive way. It encourages equal participation, accountability, and peer feedback, all of which are therapeutic goals during the working phase of group therapy. Option A is inappropriate as it may seem punitive and does not help the client develop insight. Option B, while structured, could feel overly directive and might disengage group members. Option C allows the monopolizing behavior to continue unchecked, which undermines group cohesion and discourages quieter members from participating. Let us consider a real-time clinical scenario. Question 30 that demands immediate critical thinking. The nurse walks into a client's room and finds the client lying on the floor near the bed. What should be the nurse's priority action in this situation? The options are option A, call for assistance to return the client to bed. Option B, help the client back to bed if no injuries are visible. Option C, check the client for responsiveness and level of consciousness. And option D, ask the client to describe how the fall occurred. The correct answer is option C, check the client for responsiveness and level of consciousness. The nurse must quickly assess whether the client is alert, breathing, and neurologically stable, as this determines the next steps in care and ensures that no life-threatening injuries, such as head trauma or fractures, are overlooked. This approach follows the ABCs of nursing: airway, breathing, and circulation. Option A may be appropriate later, but only after ensuring the client is stable. Option B is unsafe, as moving the client prematurely could worsen undetected injuries. Option D, while important for understanding the cause of the fall, is not a first priority. Let us now focus on newborn care and therapeutic communication in the context of a congenital defect. Question 31. The nurse is caring for a newborn with an unrepaired omphalocele and notices the parent attempting to swaddle the infant. Which response by the nurse would be most appropriate? The options are: Option A, please stop that immediately. You could seriously harm your baby. Option B, that is a nice, secure swaddle. It should help the baby feel comforted. Option C, let me assist you. We need to be gentle with the baby's abdomen so we do not apply pressure to the exposed intestines. And option D, swaddling is not allowed for infants with this condition, so you must stop right now. The correct answer is option C, let me assist you. We need to be gentle with the baby's abdomen so we do not apply pressure to the exposed intestines. This response offers a calm, supportive teaching moment while prioritizing safety. Infants with omphalocele have abdominal organs herniated into a sac outside the body, and applying pressure through a tight swaddle could compromise circulation or cause trauma. Option A is too harsh and non-therapeutic, which could frighten or shame the parent. Option B is unsafe, as tight swaddling is inappropriate in this condition. Option D is overly restrictive and could alienate the parent rather than guiding them in safe, nurturing care. Let us now consider safety measures during a psychiatric admission following a medical emergency. Question 32. A 30-year-old client is being transferred to a non-medical psychiatric unit after experiencing seizures due to alcohol withdrawal. Which nursing action should take priority to ensure the client's safety on the psychiatric unit? The options are: Option A, request a clonazepam order to help manage withdrawal-related anxiety. Option B, set up an intravenous infusion pump at the bedside. Option C, initiate an arterial blood gas analysis immediately. And option D, apply padded side rails to the client's bed to prevent injury. The correct answer is option D, apply padded side rails to the client's bed to prevent injury. Clients who experience seizures during alcohol withdrawal remain at high risk for recurrence within the first 6 to 48 hours after stopping alcohol, even if medically stable. Padded side rails help prevent trauma during a seizure and are considered a standard, non-restrictive safety measure. Option A is incorrect because clonazepam is not a first-line medication for alcohol withdrawal. Lorazepam or chlordiazepoxide are preferred, and prescribing is not the nurse's immediate priority. Option B is inappropriate, as intravenous pumps are generally not used on psychiatric units for safety reasons. Option C, initiating an arterial blood gas analysis, is unnecessary in this context since the client has been medically cleared and is showing no signs of respiratory distress. Now, let us turn to supervision and ethical practice on a behavioral health unit. Question 33. A registered nurse is overseeing the work of a licensed practical or vocational nurse caring for psychiatric clients. Which statement made by the LPN/VN would require immediate follow-up by the registered nurse? The options are: Option A, I helped the client with a bath earlier this morning. Option B, I handed out letters and packages to the clients during my rounds. Option C, the client refused to take his prescribed valproic acid, so I mixed it into his food without telling him. And option D, I will be spending time with the clients while they play games in the day room this afternoon. The correct answer is option C. The client refused to take his prescribed valproic acid, so I mixed it into his food without telling him. This response reflects a serious breach of ethical and legal standards. Administering medication covertly, without the client's knowledge or consent, violates the client's right to autonomy and informed decision-making. Unless there is a legal order or emergency, such actions are considered unethical and may even be classified as battery. The supervising nurse must intervene immediately, report the incident, and provide corrective guidance. Option A is appropriate, as assisting with hygiene falls within the LPN/VN scope of practice. Option B is acceptable as long as client privacy is maintained and mail is not tampered with. Option D reflects therapeutic engagement, supporting client interaction and observation. Let us now move into labor and delivery prioritization, where timely assessment can make all the difference. Question 34. The charge nurse on a labor and delivery unit is prioritizing client assignments during a change of shift report. Which laboring client should the nurse assign to the staff nurse first? The options are: Option A, a 28-year-old primigravida at 39 weeks gestation in active labor with a fetal heart rate of 90 to 100 beats per minute. Option B, a 35-year-old multipara at 41 weeks gestation in early labor with a history of rapid labor in her previous delivery. Option C, a 20-year-old multipara at 37 weeks gestation, in active labor, with a history of 2 prior cesarean births. And option D, a 25-year-old multipara at 38 weeks gestation, in early labor, with 3 centimeters of cervical dilation. The correct answer is option A, the 28-year-old primigravida, with a fetal heart rate of 90 to 100 beats per minute. This fetal heart rate is well below the normal range of 120 to 160 and indicates fetal bradycardia, a sign of possible fetal distress. Immediate nursing interventions are required, including continuous monitoring, maternal repositioning, oxygen administration, fluid bolus, and prompt provider notification. Option B, while requiring observation due to a history of rapid labor, is still in early labor with no current complications. Option C does require careful monitoring due to prior cesarean deliveries and the risk of uterine rupture, but without signs of distress or uterine abnormalities, it does not take precedence. Option D reflects a stable laboring client with no immediate risk factors. Let us now shift to musculoskeletal disorders, focusing on a condition commonly linked to nutritional deficiencies. Question 35. A nurse is reviewing the chart of a client who has been newly diagnosed with osteomalacia. How should this condition be best described? The options are: Option A, softening of the bones due to inadequate vitamin D levels. Option B, bone infection caused by bacterial infiltration. Option C, reduced bone mass resulting from calcium deficiency. And option D, a fracture that occurs with minimal or no trauma. The correct answer is option A, softening of the bones due to inadequate vitamin D levels. Osteomalacia occurs when vitamin D deficiency prevents proper absorption of calcium and phosphorus, leading to defective bone mineralization. This results in bones that are soft, painful, and prone to deformities or fractures. It is the adult equivalent of rickets and is commonly seen in clients with limited sun exposure, chronic kidney disease, or malabsorption disorders. Option B describes osteomyelitis, a bone infection, not a metabolic bone disease. Option C refers more accurately to osteoporosis, where bone mass is reduced, but the bone remains properly mineralized. Option D refers to a pathologic fracture, which may occur as a complication of osteomalacia, but is not the definition of the condition. Time for a quick celebration break. Did you know over 100,000 nurses have already passed using this NCLEX crash course? You can now try it completely free for 5 days. No hidden fees, just pure learning. You will get live and recorded classes, NGN case studies, 5,000 plus questions, and your own study plan. Sounds amazing, right? Just click the WhatsApp link in the description, say hi, and let us help you pass with confidence. Let us make your NCLEX dream a reality. Starting now. Let us now examine a serious condition that often follows intense physical exertion or trauma. Rhabdomyolysis. Question 36. A nurse is assessing a patient admitted with muscle pain and weakness after heavy exertion, and the healthcare provider suspects rhabdomyolysis. Which clinical or laboratory finding would the nurse expect to observe? The options are: Option A, significantly elevated serum creatine kinase levels. Option B, low potassium concentration in the bloodstream. Option C, elevated blood pressure and slow heart rate. And option D, pale yellow, clear urine output. The correct answer is option A, significantly elevated serum creatine kinase levels. Rhabdomyolysis involves the rapid breakdown of skeletal muscle, releasing large amounts of intracellular contents, especially creatine kinase, into the bloodstream. This lab value is a critical diagnostic marker and often rises to more than 5 times the normal level. Additionally, myoglobin is released and may damage the kidneys, leading to dark, tea-colored urine. Option B is incorrect because muscle breakdown releases potassium, causing hyperkalemia, not hypokalemia. Option C is also incorrect, as rhabdomyolysis typically presents with hypotension and tachycardia due to fluid shifts, not hypertension and bradycardia. Option D is misleading because clients usually have dark-colored urine, known as myoglobinuria, not clear or pale output. Let us now focus on pediatric respiratory emergencies, particularly those involving upper airway obstruction. Question 37. A pediatric nurse is evaluating an infant who presents during the night with a barking cough, inspiratory stridor, and hoarseness. The healthcare provider diagnoses viral croup, also known as laryngotracheobronchitis, Which medication would the nurse most likely prepare to administer? The options are Option A, dexamethasone, Option B, albuterol, Option C, amoxicillin, and Option D, montelukast. The correct answer is Option A, dexamethasone. This corticosteroid is the first-line treatment for viral croup, as it reduces subglottic inflammation and airway edema, leading to significant improvement in symptoms like stridor and the characteristic barking cough. Even a single dose can decrease the severity of symptoms and the need for hospitalization. Option B, albuterol, is ineffective in croup because it targets bronchospasm in the lower airways, whereas croup involves the upper airway. Option C, amoxicillin, is inappropriate because croup is caused by a virus, most often parainfluenza, and antibiotics do not treat viral infections. Option D, montelukast, is used for chronic asthma and allergic rhinitis, not for acute airway inflammation seen in croup. Next, let us explore how to recognize a therapeutic response to antidepressant treatment. Question 38. A client has recently begun taking citalopram for major depressive disorder. During a follow-up assessment, which finding would best indicate that the medication is working effectively? The options are Option A, improved balance and motor function. Option B, exhibits increased self-worth and social engagement. Option C, speaks in prolonged, overly detailed conversations. And Option D, demonstrates improved concentration and task completion. The correct answer is Option B, exhibits increased self-worth and social engagement. Citalopram is a selective serotonin reuptake inhibitor, or SSRI, designed to enhance mood by increasing serotonin levels in the brain. One of the hallmark signs of effective treatment for depression is a return of self-esteem and a willingness to re-engage socially, both of which reflect meaningful improvement. Option A is incorrect, as motor function is unrelated to SSRIs and more associated with neurologic medications like those used in Parkinson's disease. Option C suggests circumstantial speech, which is not a positive outcome and may indicate a manic or disorganized thought process. Option D may seem plausible, but improved concentration is not as specific or reliable an indicator of SSRI effectiveness as emotional and social recovery. Let us now transition into a practical dosage calculation scenario involving a high-alert medication. Question 39. A client is receiving a continuous intravenous infusion of heparin. The intravenous bag is labeled as 25,000 units of heparin in 500 milliliters of dextrose, 5% in water. The infusion is running at a prescribed rate of 1,250 units per hour. The question is, how many milliliters of fluid will the client receive during an 8-hour nursing shift? To solve this, we first determine the concentration of the solution, which is 50 units per milliliter. Then, we calculate the volume the client receives per hour by dividing 1,250 units per hour by 50 units per milliliter, which equals 25 milliliters per hour. Finally, multiplying 25 milliliters per hour by 8 hours gives us the total volume of 200 milliliters. This means the client will receive 200 milliliters of fluid during the shift. Always remember, when administering continuous heparin infusions, accurate calculation is essential to maintain therapeutic anticoagulation and avoid bleeding risks. Nurses must frequently verify infusion settings, monitor the APTT, and observe for signs of bleeding such as petechiae, hematuria, or hypotension, especially since heparin is a high-risk medication. Let us now move our attention on this client assessment series by diving into a shift prioritization scenario that challenges your understanding of neurological risk and fluid electrolyte balance. Question 40. The nurse is assessing 4 assigned clients at the beginning of the shift. Which client requires the most immediate follow-up? Here are the options. A, a client with chronic musculoskeletal pain, rating it as 8 out of 10. B, a client diagnosed with pneumonia who is coughing up thick yellow sputum. C, a client with a newly placed colostomy with mild swelling and light bloody drainage. D, a client with diabetes insipidus whose family reports sudden confusion and behavioral changes. The correct answer is Option D, a client with diabetes insipidus whose family reports sudden confusion and behavioral changes. This finding is highly concerning because diabetes insipidus leads to massive fluid loss through dilute urine, causing dehydration and a dangerous rise in serum sodium levels. Mental status changes in this condition may be the earliest sign of severe hypernatremia, which, if untreated, can result in seizures, neuromuscular irritability, or coma. Immediate nursing action is needed to assess sodium levels, evaluate fluid status, and possibly initiate intravenous fluids, or administer desmopressin, depending on whether the diabetes insipidus is central or nephrogenic. Let us now shift our focus to a pharmacological contributor to gout flares. Question 41. A client is admitted to the medical surgical unit with an acute episode of gout, and during medication reconciliation, the nurse must determine which current medication might be responsible. Among the options provided, hydrochlorothiazide, temazepam, rosuvastatin, and escitalopram, the correct answer is option A, hydrochlorothiazide. This medication is a thiazide diuretic commonly prescribed for hypertension, but it is also well known to increase serum uric acid levels by decreasing renal excretion of urate. This urate retention can lead to hyperuricemia and trigger acute gout flares, especially in clients with a history of gout. In contrast, option B, temazepam, is a benzodiazepine used for short-term treatment of insomnia and does not affect uric acid metabolism. Option C, rosuvastatin, is a statin used for lipid control and has no association with gout development. Option D, escitalopram, is a selective serotonin reuptake inhibitor used for depression and anxiety, and likewise does not influence uric acid levels. Therefore, hydrochlorothiazide is the most likely contributor and requires the nurse's attention during assessment and medication reconciliation. From a clinical perspective, it is important to recognize that thiazide and loop diuretics are common triggers for gout and should be avoided in clients with recurrent flares. Alternative antihypertensives like losartan or calcium channel blockers may be preferred. Let us move on to question 42, which focuses on encouraging medication adherence in a mental health setting. A nurse is discharging a client from a behavioral health facility who has had repeated hospitalizations due to psychotic episodes linked to non-compliance with antipsychotic medications. The nurse wants to say something that will effectively support long-term adherence. Here are the options. Option A says, if you stay on your medication, you are more likely to keep your job and avoid being hospitalized again. Option B states, I know it can be tough. I also have trouble remembering to take my own medication sometimes. Option C asks, you have stopped your medications several times. Are you aware of how often that has happened? And option D says, can you explain why your medication is important for your treatment plan? The correct answer is option A because it connects the medication to the client's real-life goals, such as job stability and avoiding future hospitalizations. This motivational approach aligns with behavioral therapy techniques and is more likely to encourage adherence. In contrast, option B, although empathetic, involves nurse self-disclosure that may blur professional boundaries. Option C is confrontational and may trigger shame or resistance. Option D, while informative, does not actively motivate or reinforce the benefits of staying on medication. Ultimately, framing the message in terms of personal benefit is the most effective strategy to support long-term compliance. Next up is question 43, which focuses on chest tube removal preparation. A primary healthcare provider has prescribed the removal of a client's chest tube, and the nurse must ensure that the correct item is readily available at the bedside. Which of the following is most essential? The options are option A, a suture removal kit, option B, a bag valve mask device, option C, a nasal cannula with oxygen, and option D, wall suction equipment and tubing. The correct answer is option A, the suture removal kit. Most chest tubes are sutured in place, so cutting the suture is a necessary first step before the tube can be removed. Having this kit on hand ensures the provider can proceed without delay. In contrast, option B, the bag valve mask device, is not part of the standard chest tube removal setup and is only used in emergencies. Option C, a nasal cannula with oxygen, may be needed if the client is hypoxemic, but is not routinely required in stable patients undergoing removal. Option D, wall suction equipment, is useful during active chest tube drainage, but not during the actual removal procedure. In short, proper preparation with the right tools, especially the suture removal kit, is key to a safe and efficient chest tube discontinuation. Let us continue with question 44, which focuses on appropriate client assignment for a licensed practical or vocational nurse, also known as an LPN or VN. The charge nurse is making shift assignments and must decide which client is most appropriate for the LPN/VN to care for. Here are the options. Option A is a client with a chest tube in place who requires ongoing oral suctioning due to thick secretions. Option B is a client receiving an intravenous heparin infusion for management of a pulmonary embolism. Option C is a client who is 24 hours post-operative from abdominal surgery and requires routine wound care. And option D is a client with new onset seizures who is currently undergoing evaluation. The correct answer is option C, the client who is 24 hours post-operative and needs routine wound care. This client is clinically stable, and the care required, such as dressing changes and monitoring for signs of infection, falls well within the LPN's scope of practice. Now, let us break down the other options. Option A, involving a chest tube and frequent suctioning, suggests unstable respiratory status that requires frequent reassessment and higher-level clinical judgment, which must be managed by a registered nurse. Option B, the client on a continuous heparin infusion, requires close monitoring of lab values like activated partial thromboplastin time and the ability to titrate a high-risk medication. Tasks reserved for an RN. Option D, the client with new onset seizures, represents an unpredictable and unstable condition requiring frequent assessment and the ability to respond rapidly to neurologic changes, which again falls under the RN's role. Now let us move to question 45, which tests understanding of proper nursing management for clients with peripheral arterial disease, or PAD. After attending a continuing education seminar, the nurse makes several statements. The question is, which of these statements indicates the nurse needs further instruction? The options are: Option A, it is important to encourage the client to participate in daily walking to promote circulation. Option B, clients who smoke must be strongly advised to quit as part of their treatment plan. Option C, resting in a recliner with the legs hanging down can help improve blood flow to the feet. And option D, we should provide devices to help elevate the client's legs above the level of the heart at discharge. The correct answer is option D, which reflects a misunderstanding. Elevating the legs above heart level can actually reduce arterial blood flow to already compromised extremities in clients with PAD. Instead, these clients benefit from keeping their legs in a dependent position to improve circulation. Now for the remaining options, option A is accurate, as daily walking promotes collateral circulation and reduces symptoms like intermittent claudication. Option B is also correct. Smoking cessation is essential in halting disease progression, since nicotine causes vasoconstriction and worsens atherosclerosis. Option C is appropriate too. Resting with legs hanging down uses gravity to improve blood flow and relieve pain. So overall, while walking, smoking cessation, and dependent leg positioning are helpful for PAD, elevation above heart level should be avoided, making option D the statement that signals the need for additional teaching. Hold up! Before we dive into the question 46, you need to know this. Over 100,000 future nurses have already crushed the NCLEX using our crash course. And guess what? You get to try it 100% free for 5 days. Yes, no payment, no pressure. You will get live coaching, NGN case studies, 5,000 plus real exam questions, PDF notes, planners, and full expert support. Just click the WhatsApp link below, say, "Hi," and boom, you are enrolled. Let us go. Now, let us take a look at question 46, which centers around proper delegation to unlicensed assistive personnel, or UAPs. The charge nurse is reviewing tasks assigned during the shift and must determine which situation requires immediate intervention. The options are: Option A, a UAP is helping a client with multiple sclerosis take a shower. Option B, a UAP is placing a condom catheter for a client who is incontinent. Option C, a UAP is transporting a client with a recent myocardial infarction to the cardiac catheterization lab. And option D, a UAP is obtaining a blood pressure and temperature for a client diagnosed with delirium. The correct answer is option C, because transporting a client who has recently had a myocardial infarction poses significant risks due to the potential for sudden arrhythmias or hemodynamic instability. This task must be done by a licensed nurse who can assess and intervene if the client's condition deteriorates en route. In comparison, option A is acceptable, as assisting with bathing is within the UAP's scope for stable clients, even those with chronic conditions like multiple sclerosis. Option B is also appropriate, since applying a condom catheter is a non-invasive and routine procedure. Option D is suitable as well. Obtaining vital signs can be delegated to a UAP, even in a client with delirium, as long as any abnormal findings are promptly reported to the nurse. Now, let us move to question 47, which highlights the clinical recognition of acute cholecystitis. A client presents to the emergency department with right upper quadrant abdominal pain, nausea, and vomiting, classic signs that raise suspicion for gallbladder inflammation. The nurse must determine which laboratory finding would most strongly support this diagnosis. The options are Option A, decreased total bilirubin, Option B, increased high-density lipoprotein cholesterol, or HDLC, Option C, decreased serum liver enzymes, also known as aminotransferases, and Option D, elevated white blood cell count. The correct answer is Option D, elevated white blood cell count, because it reflects the body's inflammatory response, which is a hallmark of acute cholecystitis. This condition is typically triggered by obstruction of the cystic duct, often due to gallstones, leading to localized inflammation and infection, resulting in leukocytosis. On the other hand, Option A is incorrect because bilirubin levels tend to rise, not fall, especially if bile flow is obstructed. Option B is unrelated to gallbladder disease, as HDL cholesterol plays no role in diagnosing cholecystitis. Option C is also inaccurate, since liver enzymes like ALT and AST may actually be elevated due to associated biliary or hepatic involvement, not decreased. Let us now take a look at question 48, which focuses on evaluating a client's readiness for ventilator weaning in the intensive care setting. A client has been on mechanical ventilation for several days, and the healthcare team is assessing whether it is safe to begin the weaning process. Which assessment data provides the most critical information for this decision? The options are Option A, recent chest radiograph findings, Option B, sputum culture results, Option C, bilateral lung auscultation, and Option D, arterial blood gas analysis. The correct answer is Option D, arterial blood gas analysis, because it directly measures the client's oxygenation, ventilation, and acid-base status, key indicators of whether the lungs are functioning well enough to support spontaneous breathing. Specifically, a PaO2 above 60 millimeters of mercury on a low fraction of inspired oxygen and a normal or compensated pH suggests readiness for weaning. In contrast, Option A, the chest radiograph, may show structural lung changes, but does not provide real-time data on gas exchange. Option B, the sputum culture, can help guide infection management but does not reflect the client's ability to breathe independently. Option C, lung auscultation, is useful for assessing breath sounds, but cannot measure how well gases are being exchanged. Let us now move on to question 49, which involves identifying a potentially harmful medication order in the context of electrolyte imbalance. A hospitalized client has been developing increasing confusion and lethargy. Laboratory results reveal a serum sodium level of 124 milliequivalents per liter, indicating moderate hyponatremia. The nurse reviews the client's active prescriptions and must determine which current order should be questioned and clarified with the primary healthcare provider. The options are Option A, dextrose 5% in water, or D5W, Option B, dexamethasone, Option C, digoxin, and Option D, ergocalciferol. The correct answer is Option A, dextrose 5% in water. D5W is a hypotonic solution that, once metabolized, leaves free water in the bloodstream. In a client with hyponatremia, this free water can worsen sodium dilution, increasing the risk of cerebral edema and further neurological decline. Because the client is already symptomatic, with confusion and lethargy, this order is unsafe and should be clarified immediately. Now for the remaining options. Option B, dexamethasone, is a corticosteroid that does not lower sodium levels, and in fact, may help retain fluid and sodium. Option C, digoxin, is not directly affected by hyponatremia, though it requires caution in other electrolyte imbalances like hypokalemia. Option D, ergocalciferol, a form of vitamin D, has no impact on sodium balance and can be safely continued. Let us now take a look at question 50, which focuses on client education regarding a gastrointestinal medication. A client with a history of chronic non-steroidal anti-inflammatory drug use has been diagnosed with peptic ulcer disease, and the primary healthcare provider prescribes misoprostol to protect the gastric lining. During a medication teaching session, the nurse must explain the primary mechanism of action of this drug. The options are Option A, it decreases the formation of intestinal gas. Option B, it accelerates the emptying of the stomach contents. Option C, it forms a protective lining over the stomach's mucosa. And Option D, it strengthens the pressure of the lower esophageal sphincter. The correct answer is Option C, as misoprostol is a synthetic prostaglandin E1 analog that helps reduce gastric acid secretion and increases the production of protective mucus and bicarbonate. This enhances the stomach's mucosal defense, forming a barrier that helps prevent NSAID-induced ulcers and promotes healing. As for the other choices, Option A is incorrect, as misoprostol has no action on gas production or intestinal bloating. Option B is also incorrect. It does not act as a prokinetic agent to influence gastric emptying. Option D is inaccurate as well. Misoprostol does not affect the tone of the lower esophageal sphincter, so it is not used for managing gastroesophageal reflux disease. In summary, the key action of misoprostol in clients with peptic ulcer disease is to strengthen the stomach's mucosal lining, making Option C the best explanation. Now let us move on to Question 51, which emphasizes the importance of psychosocial support in adolescent care. An adolescent client is scheduled for spinal surgery and will remain hospitalized for several days post-operatively. As the nurse prepares a holistic care plan, which intervention would best support the client's emotional and developmental well-being during the hospital stay? The options are Option A, encourage the parents to stay at the bedside throughout the hospital stay. Option B, coordinate peer visits during the client's recovery period. Option C, recommend patient-controlled analgesia for enhanced autonomy. And Option D, provide high-protein, high-vitamin C meals to support wound healing. The correct answer is Option B, because peer relationships are central to an adolescent's social and emotional development. Being separated from friends during a stressful time, like hospitalization, can lead to feelings of isolation or anxiety. Coordinating peer visits helps the adolescent feel connected, supported, and emotionally grounded. This approach aligns with Erikson's developmental stage of identity versus role confusion, where peer acceptance plays a pivotal role. As for the other options, Option A, while supportive, may not meet the adolescent's primary emotional need for peer connection. Option C, involving patient-controlled analgesia, supports autonomy and pain control, but addresses physical rather than psychosocial needs. Option D, focusing on nutrition, is important for healing, but does not contribute to the client's emotional or developmental well-being. Next is Question 52, which focuses on proper documentation in an incident report following a client fall. After a hospitalized client is found on the floor after an unwitnessed fall, the nurse completes an incident report. The risk manager is now reviewing the documentation for quality and accuracy. The question asks, which entry in the report indicates inappropriate documentation by the nurse? The options are Option A, a direct quote from the client describing how the fall occurred. Option B, a statement suggesting the nurse believes the client was non-compliant with safety instructions. Option C, a detailed description of bruising observed on the client's left hip and elbow. And Option D, a list of staff members and visitors who witnessed the event. The correct answer is Option B, because incident reports must be objective and factual, free from opinions, assumptions, or personal interpretations. Statements that imply blame, such as suggesting the client was non-compliant, introduce bias and reduce the legal integrity of the report. In contrast, Option A is appropriate, as quoting the client's account can provide helpful context, especially when written in the client's own words. Option C is also correct, since objective observations of injuries, like the size and location of bruises, are critical for follow-up care. Option D is valid too. Listing all witnesses is standard practice, as they may be needed for investigation. Let us now move to Question 53, which addresses safe catheterization technique during nursing supervision. A nursing student is inserting an indwelling urinary catheter for a female client who is scheduled for surgery, and the registered nurse is observing the procedure. The question asks, which observation requires the nurse's immediate intervention to prevent harm to the client? The options are Option A, the client verbalizes a strong urge to urinate as the catheter is being inserted. Option B, the client reports a brief pinching sensation when the catheter advances. Option C, the student attempts to inflate the balloon but meets resistance. And Option D, The student uses the non-dominant hand to separate the labia during insertion. The correct answer is option C, because inflating the balloon before confirming proper placement inside the bladder can cause serious urethral injury. If the balloon is inflated while the catheter is still in the urethra, it can tear mucosa, cause bleeding, and result in significant pain. The standard procedure is to advance the catheter until urine is visible and then insert it 1 to 2 inches further before inflating the balloon. As for the remaining options, option A is not concerning. The urge to urinate during catheter insertion is a normal response as the catheter passes through the internal sphincter. Option B is also acceptable, as a mild pinching or pressure sensation is expected and does not indicate incorrect placement. Option D reflects proper technique. Using the non-dominant hand to separate the labia helps maintain visualization while keeping the dominant hand sterile for catheter insertion. Now, let us take a closer look at question 54, which highlights evidence-based practice in nursing policy change. A nurse is advocating for updates to the healthcare facilities policy regarding the use of physical restraints. To strengthen the proposal, the nurse plans to present scholarly evidence at a policy review meeting. The key question is, which type of evidence should the nurse prioritize to ensure the recommendation is based on the highest level of research quality? The options are: option A, a well-written expert opinion published in a peer-reviewed journal. Option B, a systematic review that synthesizes multiple high-quality studies. Option C, a single quantitative research study conducted on restraint outcomes. And option D, a qualitative study exploring patient perceptions of restraint use. The correct answer is option B, because systematic reviews sit at the top of the research evidence hierarchy. They provide a comprehensive evaluation of multiple rigorous studies, reduce bias through strict inclusion criteria, and offer strong, generalizable conclusions that are ideal for policy development. In contrast, option A, although it may be published and well-articulated, is still an expert opinion and lacks the rigor and reliability of structured research. Option C offers useful data, but a single study cannot provide the broad, validated perspective that a systematic review offers. Option D, while valuable for understanding patient experience, is qualitative in nature, and not typically sufficient for justifying institutional policy changes on its own. Now, let us move to question 55, which focuses on evaluating a client's understanding of a newly prescribed antihypertensive medication. The nurse is providing discharge teaching to a client who has been started on metoprolol for the management of high blood pressure. After the teaching session, the nurse assesses the client's understanding. Which statement by the client best shows appropriate comprehension of the medication instructions? The options are: option A, if I feel dizzy or lightheaded, I should stop taking metoprolol right away. Option B, metoprolol lowers my blood pressure by increasing levels of angiotensin II. Option C, I need to monitor my heart rate because this medication can slow it down too much. And option D, I must take metoprolol with a high-fat meal so that it works properly. The correct answer is option C, because metoprolol is a beta-1 selective blocker that slows the heart rate and reduces myocardial workload. One of its most common side effects is bradycardia, so clients must regularly monitor their heart rate and report if it drops below 60 beats per minute or causes symptoms like fatigue or dizziness. Looking at the other responses, option A is incorrect because clients should never stop metoprolol suddenly. It can cause rebound hypertension or even a heart attack. Any side effects should be reported to the provider for safe adjustment. Option B reflects a misunderstanding of drug action. Metoprolol works by blocking beta receptors, not by increasing angiotensin II, which is the target of ACE inhibitors and ARBs. Option D is also inaccurate. Metoprolol does not require a high-fat meal for effectiveness and can be taken with or without food, though consistent timing is recommended. In conclusion, the client's awareness of heart rate monitoring in option C is the most accurate and appropriate takeaway from the nurse's teaching. Before the next NCLEX question 56, take a moment to invest in yourself. We are giving away 5 full days of access to our complete NCLEX crash course, used by more than 100,000 successful candidates. It includes live and recorded NCLEX classes, NGN prep, over 5,000 real questions, PDF study guides, and custom planners. You will be fully supported every step of the way. Just click the WhatsApp link below, type "Hi," and our team will set you up. Professional prep, real results. Let us now take a look at question 56, which focuses on the therapeutic purpose of a commonly used anticoagulant. The nurse receives a new prescription for apixaban for a hospitalized client and recalls its primary clinical use. The question asks, apixaban is most commonly prescribed for the treatment or prevention of which condition? The options are option A, pulmonary hypertension, option B, venous thromboembolism or VTE, option C, congestive heart failure, and option D, hypertension. The correct answer is option B, venous thromboembolism. Apixaban is a direct factor XA inhibitor that works by preventing thrombin formation, thereby reducing the risk of developing blood clots. It is widely used to treat and prevent deep vein thrombosis and pulmonary embolism, and it is also prescribed to reduce stroke risk in clients with non-valvular atrial fibrillation. On the other hand, option A is incorrect because pulmonary hypertension is treated with agents that lower pulmonary vascular resistance, not anticoagulants like apixaban. Option C, congestive heart failure, is managed with medications aimed at improving cardiac function and reducing fluid overload, such as beta blockers and diuretics, not anticoagulants, unless atrial fibrillation is also present. Option D, hypertension, involves antihypertensives like calcium channel blockers or ACE inhibitors, and apixaban does not lower blood pressure. Let us now take a look at question 57, which involves clinical decision-making in the immediate postoperative period. The nurse is caring for a client who is 2 days post-cesarean birth when the client suddenly reports discomfort in the right shoulder. The nurse must determine the most appropriate first action. The options are option A, administer a prescribed analgesic as needed, option B, request a stat electrocardiogram, option C, encourage the client to ambulate to relieve possible gas pain, and option D, assess the location, quality, and characteristics of the pain. The correct answer is option D, because the very first nursing priority in response to a new or unusual complaint, especially postoperative, is always assessment. Right shoulder pain may be referred from diaphragmatic irritation due to retained surgical gas, but it could also signal more serious complications such as intra-abdominal bleeding, a subphrenic abscess, pulmonary embolism, or even cardiac involvement. Therefore, a detailed pain assessment, including the onset, intensity, radiation, and associated symptoms, is critical before deciding on further action. Now looking at the other options, option A, administering an analgesic, may temporarily relieve symptoms but risks masking a serious underlying issue if done before a proper evaluation. Option B, requesting a stat ECG, could be necessary if cardiac symptoms are present, but jumping to that step without first assessing the pain may lead to inappropriate prioritization. Option C, encouraging ambulation, is a helpful intervention for gas-related discomfort. But again, it should not be initiated without first confirming the source of the pain. Let us now explore question 58, which focuses on leadership styles in nursing management. During a staff development in service, the nurse manager introduces a new approach where bedside nurses will independently decide their own meal break times and determine among themselves who will take new patient admissions. The question asks, which leadership style does this best represent? The options are option A, authoritative leadership style, option B, democratic leadership style, option C, participative leadership style, and option D, laissez-faire leadership style. The correct answer is option D, laissez-faire leadership style. This approach is characterized by a hands-off, non-directive leadership method where the manager steps back and gives complete autonomy to the team. In this scenario, the manager delegates full control over scheduling and decision-making without guidance or structured input, which is the hallmark of laissez-faire leadership. Now, let us consider the other choices. Option A, authoritative leadership, involves a top-down style where the leader makes decisions and gives clear orders, very different from the autonomy seen in this scenario. Option B, the democratic style, encourages collaboration and group discussion to reach decisions, which was not described here. Option C, participative leadership, includes the manager actively involving staff in problem-solving, but still retaining final decision-making authority. Again, not applicable in this case. Let us now move to question 59, which focuses on discharge teaching for a client with thrombocytopenia. The nurse is preparing instructions for a client who has a platelet count of 40,000 per microliter, which puts them at moderate risk for bleeding. The nurse must emphasize a teaching point that best helps reduce the client's risk of injury. The options are: Option A, continue taking your daily aspirin with meals to prevent clot formation. Option B, it is fine to shave with a straight-edge razor as long as you are careful. Option C, be sure to use a soft bristled toothbrush and brush your teeth gently. And option D, you should limit green leafy vegetables to prevent clotting problems. The correct answer is option C, because a soft bristled toothbrush helps protect the gums, an area especially vulnerable to bleeding in thrombocytopenic clients. Gentle brushing prevents trauma to mucosal tissue and helps avoid spontaneous or excessive bleeding. In contrast, option A is inappropriate because aspirin inhibits platelet aggregation and significantly worsens bleeding risk in clients with low platelet counts. Option B is also unsafe, as straight-edge razors can easily cause small cuts that may bleed excessively. An electric razor is the preferred choice. Option D may sound relevant but is actually incorrect in this context. Limiting green leafy vegetables is only necessary for clients on warfarin, not for those with thrombocytopenia who are not taking anticoagulants. Let us now move on to question 60, which focuses on promoting psychosocial development in a hospitalized, school-aged child. The nurse is caring for a child admitted to the pediatric medical surgical unit and wants to support their developmental progress based on Erikson's theory. The question is, which nursing intervention would best promote the child's developmental task of industry rather than inferiority? The options are: Option A, ask the child to track their fluid intake and output throughout the shift. Option B, let the child choose which clothing to wear for the day. Option C, allow the child to text friends using their personal cell phone. And option D, encourage the child to visit and talk with another school-aged patient. The correct answer is option A, because school-aged children, according to Erikson, are in the industry versus inferiority stage, where they thrive on tasks that give them a sense of competence and achievement. Asking the child to track their own intake and output allows them to participate in their care, complete a purposeful activity, and feel responsible, helping them build self-confidence and a sense of productivity. In contrast, option B supports autonomy and decision-making, which is more relevant for younger children in the autonomy versus shame and doubt stage. Option C promotes social comfort, but does not offer the task-based accomplishment central to industry. And option D, while encouraging peer interaction, still lacks the structured activity or skill building necessary to reinforce a sense of capability. Let us now take a look at question 61, which focuses on managing physical aggression in a hospitalized client. The nurse is caring for a client who has become physically violent and has attempted to strike staff members during care. The client cannot be redirected and poses an immediate threat to the safety of others. A provider has issued a prescription for restraints. The question is, which type of restraint is most appropriate for this situation? The options are: Option A, soft wrist restraints; Option B, mitten restraints; Option C, elbow restraints; and Option D, a waist belt restraint. The correct answer is Option A, soft wrist restraints, which are commonly used to limit upper extremity movement in combative or physically aggressive clients. They are effective in preventing the client from hitting, scratching, or injuring others, while still being considered a less restrictive form of restraint compared to leather or full 4-point restraints. Now let us consider why the other options are incorrect. Option B, mitten restraints, are generally used to prevent clients from pulling out medical devices like IVs or feeding tubes. They do not provide sufficient control for managing violent behavior. Option C, elbow restraints, are mostly used in pediatric care to prevent bending of the elbows after surgeries, and they are not appropriate for violent adult clients. Option D, a waist belt restraint, helps prevent clients from rising unsafely from a bed or chair, but it does not restrict arm movement and would not stop aggressive behavior involving the upper limbs. Let us now take a look at question 62, which focuses on interpreting hemoglobin A1C results and guiding client education. The nurse is reviewing lab findings for a client who is being evaluated for possible diabetes mellitus. The client's hemoglobin A1C result is 6.1%. The question asks, which nursing action is most appropriate based on this result? The options are: Option A, assess the client for signs of infection; Option B, reassure the client that the result is within the normal range; Option C, test the client's urine for glucose, also known as glycosuria; and Option D, provide education on dietary changes focused on low glycemic foods. The correct answer is option D because a hemoglobin A1C of 6.1% falls within the pre-diabetes range, which is defined as 5.7 to 6.4%. This value indicates that the client is at increased risk for developing type 2 diabetes, and early lifestyle changes, especially a diet focused on low glycemic foods, increased physical activity, and weight management can help prevent progression. Now for the other options, option A is not appropriate here, as this A1C level does not indicate acute hyperglycemia or infection risk that would require immediate assessment. Option B is incorrect because 6.1% is above the normal range, falsely reassuring the client could delay necessary interventions. Option C, testing for glycosuria, is typically done when blood glucose levels are acutely high, which this A1C does not confirm. Let us now move to question 63, which focuses on recognizing the clinical signs and lab findings associated with pediatric bone disorders. The nurse is caring for a 6-month-old infant who presents with delayed motor milestones, bowed legs, excessive sweating, irritability, and delayed closure of the fontanelles. Laboratory tests reveal low serum calcium and phosphorus levels. The question asks, based on these findings, which condition should the nurse most strongly suspect? The options are option A, cystic fibrosis, option B, osteogenesis imperfecta, option C, rickets, and option D, Duchenne muscular dystrophy. The correct answer is option C, rickets. This condition is caused by a deficiency in vitamin D, leading to poor calcium and phosphorus absorption and impaired bone mineralization. The result is soft, weak bones that can bend under the infant's weight, often seen as bowed legs, along with symptoms such as delayed motor skills, delayed fontanelle closure, and excessive sweating. Now, let us look at the incorrect options. Option A, cystic fibrosis, typically presents with respiratory issues and malabsorption, including fat-soluble vitamins, but does not usually cause bowed legs or isolated calcium and phosphorus abnormalities, unless complicated by severe nutritional deficits. Option B, osteogenesis imperfecta, involves brittle bones and frequent fractures due to collagen defects, and is more often associated with blue sclerae and hearing loss. Plus calcium and phosphorus levels are typically normal. Option D, Duchenne muscular dystrophy, presents with progressive muscle weakness and delayed motor skills, but it does not cause bone deformities or affect mineral levels in the blood. In summary, the clinical and laboratory picture most clearly fits rickets, making option C the most appropriate diagnosis. Question 64. Let us walk through a dosage calculation scenario that demands careful clinical attention. In this situation, the nurse is caring for a client who has a prescription for magnesium sulfate to be administered continuously through an intravenous infusion. According to the healthcare provider's order, the client is to receive 3 grams of magnesium sulfate every hour. Meanwhile, the pharmacy has supplied an intravenous bag containing a total of 20 grams of magnesium sulfate diluted in 1,000 milliliters of normal saline. So the question becomes, at what rate should the nurse set the intravenous infusion pump to ensure the client receives the correct amount of medication every hour? To figure this out, we turn to the standard dosage calculation formula used for continuous infusions. The formula is dose ordered divided by dose available multiplied by the volume available, which gives us the rate in milliliters per hour. Let us plug in the numbers step by step. We begin with the dose ordered, 3 grams per hour, and divide that by the dose available in the bag, which is 20 grams. That gives us 0.15. Next, we multiply 0.15 by the total volume available, which is 1,000 milliliters. The result is 150. Therefore, the correct answer is 150 milliliters per hour. This is the exact rate the nurse must program into the infusion pump to safely deliver the prescribed dose. Before we move on, let us quickly review the clinical significance of this medication. Magnesium sulfate is frequently used in obstetrics for seizure prevention in conditions like preeclampsia, and it is also used to treat severe hypomagnesemia. Because of its potential toxicity, close monitoring is critical. The nurse must assess for signs such as respiratory depression, absence of deep tendon reflexes, and decreased urine output. Let us move on to the next question focused on catheter care. Question 65. After inserting an indwelling urinary catheter for a male client, Where should the nurse secure the tubing to minimize urethral trauma and ensure proper function? The options are A. Inner thigh, B. Upper thigh, C. Upper abdomen, or D. Knee. The correct answer is B. Upper thigh. Securing the catheter to the upper thigh supports the natural position of the male urethra, reduces tension, and helps prevent complications like urethral erosion and bladder spasms. In contrast, option A, inner thigh, is more suitable for female clients and may cause kinking in males. Option C, upper abdomen, is not a standard site and may create unnecessary tension unless the lower abdomen is used in specific cases. Option D, securing to the knee, is unsafe due to excessive movement and risk of dislodgement. Always remember, secure the catheter with minimal tension, keep the tubing free of kinks, and ensure the drainage bag stays below bladder level for safe, effective drainage. Before we move on, here is the truth. The nurses who are passing the NCLEX fast are using this crash course. And now, you can too, completely free for 5 days. Over 100,000 students have already passed, and you are next. Gain access to live coaching, NGN case studies, exam-focused content, and real-world practice questions that actually show up on the test. Click the WhatsApp link, send a "Hi," and boom, you are in. Catch up now, or watch others move ahead. Next, let us assess the effectiveness of a prescribed antihypertensive. Question 66. The nurse is evaluating a client who has been receiving hydralazine to manage blood pressure. Which of the following findings best indicates that the medication is achieving its intended therapeutic effect? The options are A. Blood pressure of 120/70 millimeters of mercury, B. Pulse of 67 beats per minute, C. Total cholesterol of 185 milligrams per deciliter, or D. An activated partial thromboplastin time of 45 seconds. The correct answer is option A. Blood pressure of 120/70. Hydralazine works by relaxing vascular, smooth muscle, which reduces systemic resistance and lowers blood pressure. A reading within the normal range confirms that the medication is effectively doing its job. While option B, a pulse of 67, is normal, it does not reflect the specific goal of hydralazine therapy. Option C, cholesterol of 185, is also within normal limits, but this medication does not impact lipid levels. Option D, an APTT of 45 seconds, is relevant for monitoring heparin, not hydralazine. As a clinical reminder, nurses should monitor blood pressure before giving hydralazine and watch for side effects like dizziness, orthostatic hypotension, or reflex tachycardia. Now let us shift our focus to substance use education. Question 67. During a health education session for nursing students, a learner asks about the difference between physical dependence and addiction. The question is, which of the following definitions best describes physical dependence? The options are A. An obsessive craving for the pleasurable, euphoric effects of a drug, B. A physiological need for the drug to avoid withdrawal symptoms, C. Severe and potentially life-threatening reactions caused by drug toxicity, or D. Experiencing unpleasant symptoms when the drug is not available. The correct answer is option B, a physiological need for the drug to avoid withdrawal symptoms. Physical dependence occurs when the body adapts to the continued presence of a drug, and without it, withdrawal symptoms such as tremors, nausea, sweating, or seizures may develop. This physiological reliance does not necessarily mean addiction, which is more behavioral and linked to psychological cravings. Option A describes addiction or psychological dependence, where the user seeks the euphoric effects and struggles with compulsive use. Option C refers to drug toxicity, which results from dangerously high drug levels in the body and can be life-threatening, but it is not the same as dependence. Option D touches on withdrawal symptoms, but it does not fully define physical dependence, which centers on the body's adaptive need to avoid those symptoms. As a clinical note, physical dependence can occur even when medications are used as prescribed, and it often accompanies tolerance. In contrast, addiction involves compulsive behavior, cravings, and continued use despite harm. Now, let us move into wound care and infection control. Question 68. The nurse is preparing to collect a wound culture from a client with a suspected infected leg ulcer. Which action should the nurse take first before swabbing the wound bed to obtain the culture specimen? The options are A. Clean the wound with sterile normal saline, B. Pat the wound dry with sterile gauze, C. Irrigate the wound with hydrogen peroxide, or D. Put on sterile gloves. The correct answer is option A. Clean the wound with sterile normal saline. This step is essential to remove surface contaminants, old exudate, and skin flora that may interfere with culture accuracy. By cleaning the wound first, the nurse ensures the culture reflects actual pathogens present in the wound tissue, not superficial debris. Option B, patting the wound dry, is unnecessary and may disrupt the wound bed or eliminate viable organisms needed for testing. Option C, using hydrogen peroxide, is not appropriate as it is cytotoxic and can distort the results by killing both harmful and beneficial bacteria. Option D, putting on sterile gloves, is also incorrect because clean gloves are sufficient for this procedure when aseptic technique is followed. As an important clinical reminder, always cleanse the wound first before culture collection and avoid swabbing crusts, drainage, or necrotic tissue. Let us now focus on infection prevention in clients with central lines. Question 69. A nurse is caring for a hospitalized client who has a central venous catheter in place. To reduce the risk of developing a central line-associated bloodstream infection, or CLABSI, which nursing action is the most effective? The options are A. Perform hand hygiene before and after manipulating the central line. B. Monitor the client's temperature every 4 hours. C. Administer prophylactic antibiotics as a preventive measure. Or D. Maintain the client on strict bed rest to prevent catheter movement. The correct answer is option A, perform hand hygiene before and after manipulating the central line. Hand hygiene is the most evidence-based and effective strategy to prevent healthcare-associated infections, including CLABSI. Whether flushing the catheter, changing dressings, or accessing ports, the nurse must consistently perform hand hygiene to reduce the transmission of pathogens. This practice is a critical part of central line care bundles endorsed by major infection control organizations. While option B, monitoring temperature, helps detect infection early, it does not prevent it. Option C, prophylactic antibiotics, are not routinely recommended and may lead to resistance or adverse effects. Option D, strict bed rest, is unnecessary and can increase risks of immobility-related complications. In addition to hand hygiene, other prevention strategies include using chlorhexidine during dressing changes, maintaining sterile technique, and removing unnecessary lines promptly. Let us move forward to the next question. Now, let us look at a critical thinking scenario involving opioid safety. Question 70. 10 minutes after receiving 50 micrograms of intravenous fentanyl, a client becomes dizzy and nearly collapses during a transfer from bed to chair. Although the client lands safely in the chair, they appear pale and confused. What should the nurse do first? The options are A. Administer naloxone as prescribed. B. Assist the client immediately back to bed. C. Call a code blue for suspected opioid overdose. Or D. Assess the client's vital signs. The correct answer is option D. Assess the client's vital signs. When a client exhibits symptoms such as dizziness and altered appearance after opioid administration, the priority is to evaluate blood pressure, heart rate, oxygen saturation, and respiratory rate. This helps the nurse determine whether the symptoms are due to orthostatic hypotension, a known effect of fentanyl, or a more serious complication like respiratory depression. Option A, administering naloxone, is premature, since the client is still responsive and not showing classic signs of overdose. Option B, helping the client back to bed, may seem logical, but should be done only after confirming stability to avoid worsening the situation. Option C, calling a code blue, is unnecessary unless there is clear evidence of cardiac or respiratory arrest. In summary, always assess before acting, especially when opioids are involved. Let us now shift into the realm of mental health and defense mechanisms. Question 71. During a school clinic visit, a student becomes angry and blames the teacher for a failed exam. When asked further, the student admits they did not study, yet continues to insist the failure was the teacher's fault. Which defense mechanism is this student most clearly demonstrating? The options are A. Undoing, B. Projection, C. Compensation, or D. Intellectualization. The correct answer is option B. Projection. Projection occurs when someone unconsciously attributes their own negative feelings or actions to another person, rather than taking personal responsibility. In this case, the student is deflecting blame onto the teacher instead of accepting that not studying led to the poor outcome, an attempt to protect their self-esteem. Option A, undoing, involves trying to reverse a wrong behavior with a symbolic gesture, which is not seen here. Option C, compensation, refers to making up for a weakness in one area by excelling in another, and that is not occurring in this scenario. Option D, intellectualization, involves using logic and analysis to avoid emotional discomfort, which is also not reflected here. Clinically, projection is commonly observed in children and adolescents as they develop emotional maturity. Nurses and counselors can use such moments to guide students toward personal accountability and healthier coping strategies like time management and emotional awareness. Let us move ahead to the next question. Let us now focus on pediatric post-operative care following cleft lip surgery. Question 72. The nurse is caring for a 6-month-old infant who has just returned to the pediatric surgical unit after a cleft lip repair on the left side. Which position is most appropriate for the nurse to place the infant in post-operatively? The options are A, prone, B, supine, C, left side lying, or D, right side lying. The correct answer is option D, right side lying. After cleft lip repair, it is crucial to protect the surgical site and reduce the risk of aspiration. Positioning the infant on the right side keeps pressure off the left-sided incision and allows oral secretions to drain more effectively. Option A, the prone position, is contraindicated in infants due to the risk of sudden infant death syndrome and is not appropriate for cleft lip repair. Option B, while commonly used to prevent SIDS, may lead to aspiration if the infant bleeds or cannot manage oral secretions. Option C, the left side lying position, puts direct pressure on the surgical site, increasing the risk of suture disruption. As part of post-op care, the nurse should also monitor for bleeding, respiratory distress, and use elbow restraints to prevent the infant from touching the incision. Feeding should be done carefully with special equipment to protect the healing site. Let us now look at another critical question. 73. A nurse is reviewing the recent laboratory results for a client who has been taking lithium to manage bipolar disorder. The question is, which one of the following findings requires immediate follow-up by the nurse? Here are the options. Option A, a white blood cell count of 11,500 per cubic millimeter, with the normal range being between 5,000 and 10,000. Option B, a fasting blood glucose level of 112 milligrams per deciliter, or 6.2 millimoles per liter, with the normal range between 70 and 110 milligrams per deciliter, or 4 to 6 millimoles per liter. Option C, a serum creatinine level of 1.6 milligrams per deciliter, or 141.44 micromoles per liter, which exceeds the normal range of 0.6 to 1.2 milligrams per deciliter, or 53 to 106 micromoles per liter. And option D, a free thyroxine level, also known as FT4, of 0.6 nanograms per deciliter, with the expected normal range being 0.8 to 2.8. The correct answer here is option C, the serum creatinine level of 1.6 milligrams per deciliter. Here is the rationale: lithium is primarily excreted through the kidneys, and any elevation in creatinine signals that the kidneys may not be functioning properly. This creates a serious risk for lithium accumulation and toxicity, which can result in symptoms such as coarse tremors, ataxia, confusion, and even seizures or renal failure. Since the creatinine level is significantly above the normal range, this is an urgent finding that demands immediate provider notification and may require reducing or stopping the lithium dose. In contrast, a slightly elevated white blood cell count, as seen in option A, is often a known and benign side effect of lithium and does not require emergency intervention. The fasting glucose in option B is mildly elevated and falls into the pre-diabetic range, which is not immediately dangerous and can be managed in follow-up care. Lastly, the low FT4 level in option D indicates possible hypothyroidism, which is another known side effect of chronic lithium therapy, but does not require immediate intervention. It typically develops slowly and can be addressed with thyroid hormone replacement if necessary. Now, let us take a look at another situation. Question 74, involving client rights in a mental health setting. The nurse is caring for a client who has been involuntarily admitted to a behavioral health unit. One day, the client receives a package in the mail from an outside source. The question is, what is the most appropriate action for the nurse to take in this situation? Here are the options to consider. Option A, provide the package to the client. Option B, open the package to inspect its contents. Option C, hold the package until the client is discharged. Or option D, verify whether the sender is the client's next of kin. The correct answer is option A, provide the package to the client. Now, let us explore why this is the best choice. Clients who are in behavioral health facilities, even if they are involuntarily admitted, still retain their civil rights. This includes the right to receive mail and packages unless a legal order or facility policy explicitly limits this right. The nurse should give the package directly to the client. If there is a facility rule that requires checking for contraband or safety risks, that inspection must be done with the client present to protect their dignity and privacy. Simply opening the package without the client's knowledge, as suggested in option B, violates the client's right to confidentiality and autonomy. Holding the package until discharge, as mentioned in option C, restricts the client's rights without any valid legal or clinical reason. And verifying the sender's identity, as stated in option D, is not necessary, unless there is a court-ordered restriction against a particular individual. Let us move on to our next airway management scenario. Question 76. The nurse is providing care to a client with a tracheostomy and is preparing to perform endotracheal suctioning as part of routine airway care. The question is, which of the following actions demonstrates correct tracheostomy suctioning technique by the nurse? Here are the options to consider. Option A, using a size 16 French suction catheter for an adult client. Option B, withdrawing the suction catheter 1 to 2 centimeters before applying suction. Option C, using 160 millimeters of mercury of negative pressure during suctioning. Or option D, applying suction continuously for 25 seconds while withdrawing the catheter. The correct answer is option B, withdrawing the suction catheter 1 to 2 centimeters before applying suction. Now, here's why this is the best technique. Question. Proper tracheostomy. Suctioning begins by inserting the catheter without applying suction. Once the catheter is in place, the nurse should withdraw it slightly, by about 1 to 2 centimeters, before beginning suction. This ensures the suction tip is not pressed directly against the tracheal wall, which could otherwise cause mucosal trauma, irritation, or even bleeding. This method allows for effective removal of secretions while protecting the sensitive airway tissues. In contrast, using a size 16 French catheter, as mentioned in option A, is not appropriate for routine adult suctioning. A catheter that large can block the airway or damage the tracheostomy site. Adult clients should typically be suctioned with a catheter in the 12 to 14 French range. Option C, which involves using 160 millimeters of mercury of negative pressure, is also too high and increases the risk of oxygen desaturation, bleeding, or mucosal injury. The recommended range for adults is between 80 and 120 millimeters of mercury. Lastly, option D is unsafe because suctioning should be limited to no more than 10 to 15 seconds per pass. Thanks for watching. See you in practice test 19.